Welcome back to Business Today. We might as well call that a health break because today we're talking about the healthcare system and going digital. And I'm talking to MyDawa CEO Priscilla Muhio.
Yes.
Muhio. Quite an interesting name right there.
Means
I'll ask
hot.
you later what's the meaning, because I know my Mahiu, that means hot water.
So it's hot.
It's hot. Well, let's talk about financing. Because you've gotten, started in 2016. How many rounds of finances has MyDawa received, and why did we have that kind of interest for people to put money into this particular project?
So we've received two main rounds of investment from outside. However, the founder of the company, that's Neil O'Leary, he funded the company for about 3-4 years before allowing other people, not allowing, but getting investment from outside. So we've invested, AAIC have invested in us, and recently Alta Sempa, who have invested the 20 million USD. But the money is supposed to be used for expansion. Just to give you an example, we've already purchased a pharmacy in Uganda.
Okay.
They're called Guardian, and they have 19 branches in Uganda, and they are now part of the MyDawa family. So the main objective for that funding was for expansion into East Africa. Yes.
Why Uganda and not Tanzania? Maybe for starters?
I think the opportunity presented itself in Uganda, and they were in the market, they were selling, and we took advantage of that. That's the reason mainly, yeah. And they're doing very well, actually. Yeah. They're actually EBITDA positive. So they already have their business running, and they're established, and that's the reason why we went for them.
And private equity, when you talk about them stepping in, I mean, they have to make their money.
Yes.
In regards to the healthcare sector and investment into this particular sector, how long does it take to recoup your investment for the $20 million? How long do we have in that regard?
Well, to be honest, I have no idea what the plans for Alta Sempa are, but if I look at the industry trend and all that, I think 5 to 6 years should be enough for you to have an exit plan and sell the business for profit. I think within the next 5 years, MyDawa will be a totally different business, big business that will, if they want to exit, they can sell at a very good profit. Yeah.
Why that confidence that in the next 5 years, this will be totally different?
It's even based on the numbers you were showing earlier. I can share with you our current strategy. Current strategy is to focus on the chronic diseases that I talked about before. And the reason is because there's a big opportunity to help patients who have chronic diseases to lower the cost of medication. To just give you some numbers, 1 out of 4 adult women, one of them is dying out of a non-communicable disease or a chronic disease. 27% of the deaths in Kenya are because of a chronic disease. And then 50% of the admissions in Kenya are because of the chronic diseases. So that tells you it's a big problem. In fact, if you compare it to the normal, the normal communicable diseases like diarrhea, etc., you're seeing the prevalence increasing more on the non-communicable diseases, and it's because of the lifestyle we have, and it's because we need to start looking after ourselves. Otherwise, we're going to start getting diabetes and hypertension at an early age. So there's a big problem there, and we see an opportunity to help people with the current people with the disease to lower their cost. At the same time, work with the different players in the industry to create awareness about how to make sure you're taking care of yourself so that you don't become a patient in the chronic disease space. Yeah.
All right.
Yeah.
Of course, in sync with the end-to-end.
Yes.
So as much as we are helping you through the journey of chronic illnesses, we also working to sort of prevent that.
Yes.
And you're saying that lowering the costs. I know early on you touched about how technology can help lower costs.
Yes.
Regards to chronic diseases in this country, why is medication for chronic diseases that expensive?
It's because it's an always-on cost. It's a lifetime cost. And if we don't figure out how to reduce that cost, it also affects the household spending. So ideally, people with chronic diseases kind of don't have a choice. They will sell land, they'll sell cows or whatever they have to do to make sure they have the medication. Otherwise, they'll pass away, right? So if we figure out how to lower the cost of medication, even by 20%, it will make a big difference in someone's budget because this is a lifetime cost. Whether they like it or not, they have to keep taking this medication.
Definitely.
Yeah.
And as a player in the health ecosystem, how critical is the insurance sector, especially for that sector that you're targeting, chronic diseases? Are we seeing similar interest from the insurance world?
Yes, we do work with insurance. Currently, we work with about 21 insurance companies here with MyDawa in Kenya. And it's a concern because they enroll people into a scheme and then they find a couple of them with chronic diseases. And we're working with them to help them lower the cost with the same end-to-end journey that I talked about earlier. And as you know, the penetration of insurance is super low, less than 5% here in Kenya. So we have people who are actually spending out of pockets, like spending money out of pocket. For that, we've also launched a program called Mzima, focusing on hypertension and diabetes. So ideally what happens is for you to enroll, you just book a consultation with a doctor, and we enroll you into the program where a doctor calls you every month just to follow up with you, and if you need medication, we write for your prescription and deliver it to you. So that is how we are trying to work with the patients, especially those who are paying out of pocket, because doctor consultation costs are super expensive together with the medication. So by aggregating all these people, we are able to go back to the manufacturers and negotiate good discounts and pass those discounts back to the patients. So with this Mzima program, we are able to do that. This is a way of us aggregating the patients.
Okay.
Yeah.
And I'm thinking of the overall sector and even the country at large. There was this discussion, I think I attended one of the sessions between the president and manufacturers in this country. You're saying we are hitting below par when it comes to our manufacturing sector. So they are giving this sort of presentations regards to the potential areas. And in terms of making of medicine, manufacturing of medicine within the country, it holds so much potential. As somebody who deals with medicine end to end in a way each and every single day, what will that mean for the healthcare sector if we are able to manufacture these medicines within this particular country?
The challenge with local manufacturing, and anyone will tell you, is the fact that the APIs, the drugs that are used to, the different components that are used to make the drugs are super expensive. This is because they're coming from India and China. Only a couple of economies are manufacturing the APIs. And buying those inputs is super expensive, and these costs makes it expensive for us to manufacture drugs, and then those costs are also passed down to the consumer. So that's our biggest challenge when it comes to local manufacturing. Getting those APIs into the country is not cheap, and it's a problem. There's an opportunity for a country in Africa to produce the APIs and then reduce the cost of logistics and also cost of these APIs. Currently, we don't have that in Africa, and I think the opportunity lies in producing those APIs ourselves. But currently, they all come from either India or China. And that's a big problem.
All right.
Yeah.
And before I let you go, lastly, we are looking now in terms of making your farm. This is for the business people out there who are entering into different spaces. They will like funding. They like that private equity firm to come in and give them $20 million. They expand to Uganda, or follow you, or go to Tanzania. How do you make yourself ready for that? How do you prepare yourself for that?
What I always advise small businesses or startups is to focus on identifying a real consumer problem. And the key word there is real. So sometimes we come up with an idea and we think it will solve a real consumer problem. But when we go to the market shocks us with insights, but we ignore and still go ahead. So I think the initial stage of finding the product market fit is super critical. Once you find that product market fit and showcase that there's a real problem to be solved and show that there are many people with this problem and they are willing to pay, no investor will say no to you because the opportunity is there. So I think most startups, what they struggle with at the beginning is just finding that product market fit. And once you find it, I think it will be easy for you to get funding. It's much easier for you to get funding.
Deal with the fundamentals first.
Fix the
money
basics
will
first.
follow.
Yes,
the
money
basics.
will follow.
That's incredible. Thank you, Priscilla.
Thank you so much for having me as well.
This has been a good chat. And hopefully we see how the industry grows. Priscilla Muhiu is the CEO of MyDawa. She says that the sector actually in the next 5 years, it'll totally be a different company. Looking at the numbers that you've presented here in regards to investment in the health sector, there is so much potential in that regard. So everything is going electronic, even your health is going electronic, but it's not doing away with everything brick and mortar. We still need to go to those hospitals. As we were saying, even the number of beds still going up and health facilities going up, which is very critical. That has been our conversation on matters to do